Ostomy Care Consecutive Interpreting Practice Dialogue 1. During this interpreting practice, Mrs. Okoro, the patient, is working with a Wound Ostomy Continence or WOC nurse, also known as a stoma nurse, during a dedicated teaching session. This is the patient's first time learning how to change their ostomy pouch after surgery. The nurse guides them step by step, addressing their fears about doing something wrong and helping them gain confidence in managing their care. There will be a pause after each speaker, allowing you time to interpret. The dialogue starts now. Knock knock. Hi Amara. It's me, the stoma nurse. I came by for our teaching session today. I know this can feel like a lot to handle. How are you doing with everything after surgery? Hey, I'm okay, I guess. Just nervous. Honestly, I feel overwhelmed. I keep thinking I'm going to mess this up. That's completely understandable. It's even normal. You're learning something that's completely new right after a major surgery, and that's a big deal. This session is all about taking your time to learn and practice. You're not alone. I'm here to help you through every step. Thank you. I appreciate that. I just keep thinking, what if I do something wrong? Or what if I hurt myself or cause an infection? That's a very common fear. But I promise, with the right technique, you won't hurt yourself. It might feel uncomfortable at first, but with practice, it'll become second nature. Let's take it step by step and start with removing the old pouch. Okay, let's do it. How do I take it off without pulling on my skin too much? That's a great question. So what you're going to want to do is start by peeling from the top and working your way down slowly. Hold your skin gently with one hand while removing the adhesive to prevent pulling with the other. Slow and steady, no need to rush. Okay, I understand, but what if it starts bleeding when I clean it? That happened last time and I panicked. I can see you're worried about that. A little bleeding can be normal, especially when you're still healing. Just clean the area off gently using warm water and a soft cloth, but no soap unless absolutely necessary. Afterward, pat the area dry with a towel, no rubbing. The skin around the stoma has been really itchy lately. Should I be worried about that? So the itching could be from some irritation, possibly because of moisture or the adhesive itself. What you can do is put some barrier powder around the stoma. That will help absorb the moisture and prevent irritation. Just apply a light layer for protection. And how do I make sure the pouch fits properly? I don't want it falling off or leaking. So for that, what we're going to do is measure your stoma using this guide. Then you're going to cut the wafer slightly larger than the stoma, enough for it to be close, but still a comfortable fit that doesn't press directly on the stoma itself. I'm really worried about leakage. It feels like the seal isn't strong enough sometimes. Yes, that can be worrisome. Leaks can happen if there are small gaps between the wafer and your skin. Stoma paste or putty can help with that. You'll apply a thin layer around the wafer's edge to seal any gaps and prevent leakage. Okay, but what if it leaks afterward? If that happens, we'll reassess the size of the wafer or try a different pouch. But for now, let's focus on practicing these steps together. Would you feel comfortable trying it now? I think so. But could you stay here with me while I try? I think I'd feel better knowing you're here. Of course. I'll be right here with you the entire time. This is all about learning and getting comfortable. You're already doing a great job just by being here and trying. Okay, let's get started.